Hello, listeners. Welcome to Refugee Voices. Today's episode, we bring on Ami Dodson from JFCS East Bay. Amy, do you want to introduce yourself?
Sure, happy to. My name is Ami Dodson. I'm the Volunteer Services Manager at JFCS East Bay. I've been in this position for about 3.5 years, and I've been with the agency for about 5 years before that.
Wonderful. And Amy, I know your organization does wonderful things. So, do you want to start off by talking about what you guys do in JFCS East Bay and your role specifically?
Sure. So, JFCS East Bay is a full scale human services organization. We provide support to um, clients ranging in age from essentially birth to senior citizens. We have four main program divisions. We have a parents, families, and youth division that serves low-income families in Alameda County. We have an older adults services division that serves Holocaust survivors and Jewish clients in Alameda and Contra Costa County. We have an immigration legal services division, which helps people who are undocumented as well as Afghans who are looking to adjust their status, and we also serve asylum seekers in that department. And then our biggest division is our refugee services division, which resettles refugees all across Alameda and Contra Costa counties.
So I know JFCS is a pretty old organization. Could you describe the early days of JFCS and then the early days of when you first joined and your role?
Sure, that's a tough one because JFCS has been around since 1877. We're almost 150 years old. We were originally founded as the Daughters of Israel Society by women who had fled the pogroms of Eastern Europe. But we have been consistently resettling and helping refugees specifically in the East Bay for nearly 150 years. I don't know much about what things were like in 1877. We've gone through several name changes and different iterations, but now we serve hundreds of refugees a year. When I started with the agency, it's been it'll be almost 8 or 9 years. I think 9 years. November, I think, will be 9 years. We were much smaller. We served around 120 refugees a year in that particular department. And then in 2008, before I joined the agency, we started focusing on serving specifically Afghan refugees. We serve refugees from all over the world, but our specialty is Afghans, and a lot of our staff is Afghan. So when I started with the agency, we served maybe 120 people a year. Then when the collapse of Afghanistan happened in August of 2021, and a humanitarian crisis ensued, we were very well poised to leap into action. We already had a lot of experience helping Afghan refugees in particular. And so we went from serving 120 people a year to, in the height of the crisis, we were serving 120 people every couple of weeks. In 2022, we resettled about 1,000 individuals. And we just finished the federal fiscal year. We resettled 500 people at the close as of September 30th, 2024. The new federal fiscal year has just begun. Our targeted number for FY25 is, I believe, 370. However, based on experience and years past, we expect that we will hit that 370 number probably sometime in March or April. And then we'll be asked to increase our capacity and resettle more people. I imagine we will probably finish out the current fiscal year around the same as we did last year, which is about 500 individuals.
Yeah, so Amy, tell me about that time when obviously there was a huge increase in Afghan refugees coming to the Bay Area. And tell me about the challenges you guys faced and how you were able to meet the needs of so many individuals.
It was hard. It was hard. We didn't have enough staff at the time. The agency was much smaller. So we had our director of refugee services, who is herself an Afghan refugee. And I think we had 2, maybe 3 case managers. So we had to hire a lot of people very quickly. I added a full-time team member to my team. At the beginning, my department was just me and 2 half-time people. Now we're up to myself, and then I have 3 full-time staffers and 1 part-time staffer. So we've got we've grown a lot too. But my colleagues in the Refugee Services Department, they worked their tails off. They were around the clock helping people. It helped that there was a lot of media attention and a lot of national attention on that crisis. We received a tremendous flood of donations that enabled us to provide cash support and rental support to nearly every refugee we served. We also had we still do, we have an Amazon wish list of items that our clients need. I'm not sure exactly how, but that wish list went viral. And I mean viral. Like, we were receiving 400 Amazon packages a day. I had the local Amazon warehouse delivery guy on speed dial, because he'd call me and be like, "All right, I'm coming in with 4 trucks. get ready." So that enabled us to provide a lot of material support for our clients. Most of our clients come here with next to nothing. And so having things like a toaster and a blender and diapers for their children and hygiene kits is a really big deal for all of those people. So we got through that crunch time with the support of our community.
On the topic of media attention, obviously, crises that have more media attention around them, more help is on those. And there's certain crises that, for example, the South Sudan situation that doesn't receive a lot of media attention. So, those do you guys help a lot of those places out too, such as the African countries?
Yeah, that's a great question. It is a in Hebrew we say a shanda, which means it's a travesty. It's an outrage that there's not more media attention being focused on South Sudan and the atrocities that are being committed there. So as a local refugee resettlement agency, we don't actually have a lot of control over which clients get sent to us. That happens at the national level. We have a national partner called HIAS. HIAS contracts with the federal government, and HIAS assigns clients to us. So we get most of the Afghans because there's a very large Afghan population and community here in the East Bay. And the refugee resettlement system nationwide is set up to send people where they are most likely to be on a path of self-sufficiency. So where there's already a community to support them. So that's why we get most of the Afghans. We have a sister affiliate in, I think it's in Minneapolis. They tend to get most of the Somalis, right? Because there's a very large Somali community there. So we haven't received any refugees from Sudan that I'm aware of. We do frequently get refugees from Eritrea, Uganda, Senegal. There are several different kinds of visa. There's several different kinds of visas. The Afghan clients tend to come in on one particular kind of visa. We get clients from all over the world, however, on different kinds of visas, but those numbers are much smaller. I think we've had just a handful of African refugees over the last year or so.
And obviously, with so many different people coming from different areas, how do you guys meet the needs of each individual refugee? Because I'm sure that someone that comes from Eritrea may have a different skill set, a different level of understanding of what is going on and what their next steps are compared to
Yeah.
a refugee from another country.
Yeah, absolutely. So we've built up our case management staff. I can't recall off the top of my head how many case managers we have, but it's more than a dozen, and they come from all over the globe. So we actually have an Eritrean case manager. A lot of our case managers are from Afghanistan. We're also serving a lot of Ukrainians, and we have 2 people on our staff who are either Russian or Ukrainian. So as much as we possibly can, we try to have our staff represent uh, the clients that we serve. For example, we had 4 Senegalese clients over the course of the last 6 months arrive, all of whom spoke French. 1 or 2 of them had English language skills, but 2 of them spoke no English at all. So we brought in a French-speaking volunteer to help us with that. We also have access to things like a language line, so we can have interpreters on the phone with our clients. But as much as possible, we try to find staff or volunteers who speak the languages of the clients that we serve.
And when you're serving these refugees, what do you think are like the biggest issues or drawbacks that they face? When we were in Greece, some of the biggest ones that I found were like mental health and a lack of educational services that sort of prevent them from like thriving in their communities and wherever they go off to. So, what would be some of those for you in your experience?
Yeah, mental health, absolutely. All of our clients have endured some amount of trauma by the nature of being a refugee, right? They have a refugee is someone who has been forced to flee from their country of origin through, without. It's not their choice to leave; they've been forced to flee, and so that comes with trauma for sure. So we have a lot of mental health needs. We have we have multiple mental health clinicians on staff. And then we also have contractors we work with we have a Farsi and Dari speaking therapist that we can refer some of our clients to. And we also have a Ukrainian and Russian speaking therapist that we can refer our clients to for mental health services. And then on staff, we have Spanish speaking therapists as well as therapists that speak English and some other languages. So mental health is certainly a very big one. Housing is always a challenge in the Bay Area. It's really difficult to find affordable housing for all of these folks. We're very proud, however, that we do. We have a full-time housing specialist who works with landlords across both counties to secure long-term permanent housing for all of our clients. And we help with rental subsidies so that they can have a couple months to get on their feet while they look for jobs and become have earning potential. I think that one of the biggest challenges, I mean, beyond mental health and housing, which are definitely 2 of the biggest, is that it's hard. It's really difficult to uproot and move to a new country. And some of our clients have English fluency. Some of our clients have high levels of education. A lot of our clients have no education. Some of them are illiterate even in their own spoken languages. So being able to serve people across that tremendously broad spectrum and provide individualized services so everyone can flourish with dignity in our community, as we say. It's a challenge, but we have a really great team and a lot of very competent staff who've been doing this work for a long time.
Mhm. And I'm curious, so when the refugees come and look for employment, um, one of our main focuses in our organization is based on entrepreneurship, just because those, even without education or degrees, they can get a chance to, start with what they're passionate about. Maybe they want to start a restaurant or they want to sell their crafts or clothes. And so those who do have education, or from what you see, where do the refugees usually find employment, or is there no like general trend in that situation?
There's definitely trends.
Hmm.
It's different for every family, of course. Typically, our typical Afghan family is mom, dad, and anywhere from 3 to 5 kids. We talk to our clients about a survival job, and that's we really push them to get whatever job they can, just to get some income coming in. We have a full-time employment specialist on staff who, much like our housing specialist, her job is to facilitate relationships with employers and to work with our clients to help them find jobs. We have a really robust career coaching volunteer program where we have volunteers and we'll match them with a client and the volunteer will help that client with a resume, maybe practice interview skills, help them look for jobs. But we really urge our clients to take whatever job comes their way first, just so they can have income coming in, and then they frequently can trade up from there. A lot of our clients do work in the gig economy. A lot of them drive, if they have cars, they drive Uber. Some of them, a lot of them work in Afghan markets or other Afghan-owned businesses. There's a really lovely network of Afghan community in the East Bay. But for the most part, everybody finds jobs eventually. Sometimes they're starter jobs, they're survival jobs. But then a lot of our clients are, some of them have advanced degrees from their home countries. So that's another challenging barrier for someone, like, for example, who is a doctor, a physician in Afghanistan. They have to go through a lot of certification and training in order to get a medical license in the United States. It's very difficult. And that's true also for like people who are civil engineers, for example, or other academically driven jobs.
So I'm sure it's very difficult for many of them to, be immersed into a completely new environment. We were just talking about jobs. There's also probably a culture shock. As you said, many of your clients are Afghan refugees, and there's obviously a very big different culture in Afghanistan and the United States. So how is that for them in your experience? How is it like to assimilate into a completely new culture, new language, new food? Is it damaging for some of them? Do some of them like take it with a smile on their face and they just accept it, or do some of them sort of like refuse it and want to stick to their own culture?
Yeah, that's a really interesting question. For them, mostly they adapt very well. You're right; it is a big culture shock. It is very difficult. But most of them adapt just fine. Every now and then, rarely, we have we'll have like, for example, we had a client last year who from Afghanistan who refused or tried to refuse to allow his daughters to go to school, and we had to do a lot of coaching about how in this country that's not an option. You have to send your daughters to school. You can't just send your sons. Your daughters must go to school. We have laws about that. It took a long time and a lot of patient explaining and coaching from our staff to help him understand that this is it's different here. But that's rare. That's rare. For the most part, our clients are eager. They're eager to be here. They want to be in America. They want to stay in America. They want to be participating citizens of society. And a lot of them, after they've been here for 5 years, apply for citizenship. So they're very committed to being Afghan Americans.
Yeah, and we've talked to many leaders like you who've worked in an organization, worked with clients for many, many years, and they always mention about there being a huge bond and connection through the refugees that they work with directly. So, is there anything for you that you remember or is close to your heart in terms of impactful success stories, or something where one of your clients is still in contact with you after years of working with you, or any just memorable experiences from your time at JFCS East Bay and also any elsewhere that you might have worked?
Oh, sure. Oh my goodness, I have so many stories. One of my favorites. So before I became a staff member at JFCS, I was a volunteer, and so I volunteered with the agency for a couple years before I started. Before I took a position as on the team as a staff member. And so when I first got involved as a volunteer, I was assigned to be a helper for a newly arrived Iranian family who were Baha'i. And in Iran, there's a small Baha'i population in Iran, but they are deeply persecuted. They're not allowed to own property or go to school, and they face a lot of persecution and oppression. So there's a visa program for members of the Baha'i faith to escape Iran and come to the United States. And so this family did that, and I was sort of assigned to be their volunteer. I was helping dad learn English. I was taking mom to the food bank. They had a teenage daughter as well as a younger son. So I helped the teenage daughter, or she was like 19, enroll in community college. Her English was very good, so she was helping her parents learn English. We helped her little brother get enrolled in school. Eventually, around after I'd been working with them for a couple months, it was Halloween, and so the neighborhood that I live in is like a huge Halloween is a big deal. And so we went trick-or-treating together with them and our friends, along with my kids. It was really sweet and very special. And it just so happened that this family I was sitting at my desk and I looked up and I was like, Panis, what are you doing? They had come into the office because even though they've long since graduated out of our refugee program, they've now been here long enough that they're applying for citizenship. And so our immigration legal services team was helping them go from being a green card holder to actually being an official U.S. citizen. And their applications are pending at the moment, but it looks very good for them. And so soon they will be American citizens as well, which is just a very heartwarming. It was lovely. I hadn't seen them in several years, and it was really lovely to have that experience.
Yeah, that sounds wonderful. I think stories like that truly inspire people to really help out in this cause. And speaking of that, I think as a refugee leader, you can probably agree to this, that if just everyone did just a little bit, like 1% more for this cause, even just donating a bit, it would make a huge impact.
Absolutely.
So, in your opinion, in what ways can the broader community help in this refugee crisis?
Oh, so many ways. I mean, volunteer your time is a big one. We have about 700 volunteers in our database, and I still struggle to find enough people to help. So some of our volunteer jobs are really easy. They take, a few minutes. Other volunteer opportunities can be a commitment of up to 3 to 6 months. But there's a huge range. So there's really something for everyone. So, even if somebody has just like an hour a week to volunteer, that makes a big difference for us. There's no shortage of need for things. Every client family that we serve gets a hygiene kit from us, and that's like a shampoo and conditioner and toothbrushes for the family and toothpaste and whatever. So we sort of have a bottomless need for toiletry and hygiene supplies, as you guys know, because you've helped us with a couple of collection drives. There's just a lot. And then of course there's the financial component. I mean, most of our funding comes from grants and contracts that we have, but we also have to fundraise a significant amount of money from personal and individual donations every year in order to keep our doors open and the lights on.
Okay, that sounds great. And Amy, as we're sort of wrapping up, is there any final message that you have for our viewers at home about this refugee crisis? Any more information that you sort of want to leave them with before this ends?
Just get involved. Pick something, pick JFCS or pick someone else, but get involved. And even if you don't have the time or capacity to get involved as a volunteer, there's still ways that you can help, like lobbying your congressman, for example. There's legislation that we've been working to get moved through the state legislature that would help provide greater support for refugees in California. There's always something that can be done. And however small it may seem to you, it definitely doesn't feel small to us. And it absolutely would not feel small to the client or the refugee on the receiving end of your time and volunteerism.
Well, thank you so much, Amy, for coming on to our podcast, Refugee Voices. I'm sure this has been a very insightful and informative episode for our viewers. The work that you do and that JFCS does is truly inspiring, and I think that everyone can take something away from it. Thank you so much for coming on. Do you have any final questions? Do you have any final questions?
Do I have any final questions? I do not. Thank you so much for having me. It's been a real pleasure. This is my first time appearing on a podcast, so I'm feeling very excited about it. Thank you so much for inviting me.
All right, thank you.